There are many different levels of vision loss. It is important to accommodate an individual's needs, but at the same time, there are some general rules to follow to make your evidence-based wellness program more inclusive and welcoming. The following tips will help you to prepare the needs of participants with vision loss or blindness. 1. During the registration process, ask individuals if they need accommodations to participate. Make arrangements ahead of time to obtain alternate formats such as Braille and large print. 2. While teaching, present information in a variety of ways that include audio descriptions to hear, visual models to touch, and items to smell. Within nutrition education, examples could include using food models to demonstrate portion sizes and reading nutrition labels on food packages. 3. Whenever you have person-to-person interaction, it's important to remember tips for effective communication. These can include introducing yourself to someone when you start a conversation and orienting the person to where you are in the room. If you leave the conversation, let the person know. If you have to give personal health information, such as reading out loud a participant's weight, maintain privacy. 4. Keep the classroom or teaching environment decluttered and consistent to avoid tripping hazards and for easier navigation. If someone has partial vision, make sure you're in a well-lit place while teaching. Provide space to allow for service animals. 5. Be prepared to be a sighted guide by offering your arm for the person to hold on to. Be sure to move at their pace and get their permission first. They may not want or need help. If providing directions of any kind, use terminology like right, left, and under, or clock cues such as 2 or 3 o'clock to suggest moving to the right. 6. If your program is virtual, make sure you and everyone else identifies themselves when they start talking. Be sure to use verbal descriptions, such as possible to describe visual aids. 7. Use an accessible video conferencing platform. Accessible videos have captions and audio descriptions. 8. Always be thinking about contrast. For example, a purple onion on a white cutting board is easier to see, or dark letters on a light background. For more information and tips for kitchen accessibility, food preparation, and general inclusion for people with vision loss, visit NCPAD's website at www.nchpad.org.